The Poke and Procedure Plan, using the voice and choice of patients and families in partnership with their healthcare team.
We often think about the POKE plan or comfort measures for pediatric patients, but it's also important to consider it for our adult population. Although the physical pain may not be as impactful, anxiety can really take over for adults. Results from testing would be relying on whether or not they can have care that day, whether or not they're getting their treatment, and also they have very fond or unfond memories of previous experiences as well. And they remember those things that don't go so well, and will bring that to the next experience with them.
Patients come to Michigan Medicine with unique experiences which shape their views and expression of pain and anxiety.
Getting poked creates anxiety for me, especially having to get a lot of blood draws. My veins, some of my veins have scarring, and then also my veins roll or they're not easy to find.
For many, getting their blood drawn, getting an IV, or changing a dressing is more than a simple task. It is an experience that causes physical effects as well as prolonged psychological effects. Although pain cannot be completely avoided, there are some things that can be done to make these types of pokes or procedures a more positive experience.
I think it gives you a voice.
Yeah.
It kind of gives you a control over your medical care, which is always good.
Yep.
I think a lot of times you're scared, sometimes I'm scared.
Yeah.
And having a voice and having control over your medical care makes you feel a little more like you're doing something and you're busy and you're confident. And
Staff and caregivers work together with patients and families to develop an individualized plan of care to decrease pain and anxiety with procedures. This practice also promotes coping skills that patients and families can use for a lifetime.
Some people have PTSD, some have needle phobia, and generally individualizing care for everybody in the health system equates to a higher quality of care. And when you include the whole family where the patient returns home to get all of their care provided for and also help them along the journey back to wellness, when you include everybody in that, it really elevates the level of care. And I think that's where medicine and nursing is headed to today.
Now when the caregiver and patient establish a plan, it is available in the electronic medical record and can be used by other providers across the healthcare system. If you have a patient who seems nervous or anxious about a poke or procedure, try these easy steps to create a poke plan. First, introduce yourself and establish a relationship. Second, create a partnership with the patient and family or caregiver. Third, learn the patient or family story to find out what has worked for them in the past and identify with the patient which choices are best for them. When the questions have been answered, the choices of care are identified and added to the patient's medical record. The plan is now available in all places where the patient receives health care at Michigan Medicine. By working together with the patient and family, listening to their concerns, we are all improving the patient and family experience at Michigan Medicine.